Who here is old enough to remember when zero for computers was zero? There were no computers. So we have gotten from there, right, to a place where we wondered, I wonder if there could be a computer that plays chess, or maybe even wins at chess. And then I wonder if we could build a computer that could play Jeopardy, maybe even win Jeopardy. And now we're at a place where we're wondering, can we build computers that can change the world, that can change what we do, that can accelerate the progress that we've made, that can look at all those components and that we look at, all that interoperability, all the data, and do something else, do something different, do something that pushes the envelope, that pushes what we do ahead. What I think and hope that Claude is going to do with us today is take a look at exactly that. How is Watson being used, how Watson can be used to further the work that we're doing, and maybe even to change that world that we're all trying so hard to change. Claude, please. Oh, I got it all half.
Perfect. Thank you very much. Thanks for your time today. I appreciate being with you. And it's really interesting to me to have this discussion because I have some background in healthcare myself. And when we're talking about history, one of the things I worked on, and this has to be 15 years ago now, was what we used to call community health information networks, CHINs. I don't know if any of you ran across those back in the day. But we worked on CHINs, and in particular in Canada, because of the way their healthcare system was organized. It was very adaptive to it, and we set one up in Ontario for the Hospital for Sick Children. And it was a child health network that was meant to say, how do you put the child in the best place to receive care? And one of the challenges we always faced was we had a certain amount of information from sick kids and the other hospitals and how to bring it together. But we sometimes lacked the basic information about saying where was a child going to be best served. Did they really need to be at sick kids for the kind of intervention they needed, or could they be dealt with more effectively at a regional hospital? And a lot of what we couldn't tell was some of what you're talking about in the social determinants. What was the support they were getting in the home? What were the other needs that the child had, which we couldn't see? So we adapted around it. But what's really compelling these days is that we have the opportunity to take advantage of that information. And that's what I want to talk to you about today. And what's the theme of what's evolving in our perspective at IBM, and I think it's shared by many people, in the ability to use information. So this graphic gets to the message you just said. At the bottom end is a tabulating systems era. And I remember when I was a freshman in school, so this will date me, we weren't tabulating, but they were moving out the very last of the key punch machines where you'd punch in a deck, and then run it through the computer, and that would run your program for you. And after that, we used terminals. So I think I almost lived the branching of that gap. But what's happened is, over the past number of years, we've gone from the traditional mainframes that have become more powerful, obviously, into mobile devices, our watches, our phones, many, many types of computing capabilities. And they did develop the kind of function that you described, where you could adapt them to do something very powerful, such as play chess and beat the world's champion, or be able to win in Jeopardy, which are interesting touch points that say, how capable can a computer be to emulate the way a person tries to do something that's complex? And that's a bit of what spurred us to the challenge of the cognitive systems view. And I would suggest to you that in addition to what we've called the traditional programmable systems era, there's a new era developing, which is the cognitive systems era. And I don't mean for that to say that we're replacing the traditional computing capabilities. We're going to complement it with cognitive. And I want to spend a little bit of time talking about what is cognitive, how do we see Watson playing in that cognitive environment, and what is its promise in terms of our ability to use it. Three things could distinguish what we consider cognitive, and they're listed here. I won't try to read this to you, but let me try to give you a bit of an example. The first is it understands language. Cognitive means I can ask a question just like I would ask you a question. For example, one of the questions on my mind, how do I find that parking garage where I left the car earlier so I can get back home? And I know it's on that side of the campus, but I don't remember the map, and I think I remember the level at which I parked. Beyond that, there's going to be an expedition this afternoon. So I want to be able to ask a system, help me find my car. And no, I didn't punch it in on my app when I should have said, where's the parking location? So that's a question that a human asks, and that's the kind of interaction we see a cognitive system having with us versus you type in 5 keywords and try to sort out what the meaning is through your keywords. The second aspect is experience learning. The technical term is machine learning, but the fact is systems can learn from what they've done and apply it to the next instance in which they do something. And that machine learning is something that we're able to implement in cognitive and also incorporate into Watson. And then finally, evidence. What gives me the reason to believe that something is the case? Because one of the aspects of cognitive, and you may have seen this in the Jeopardy challenge if you watched it on TV, it would tell you Watson thinks with confidence level percentage, this is the answer. The point is, there are no clear-cut yes-nos to a lot of questions. There are multiple choices that have different levels of confidence. And the evidence behind it is what gives you the reason to believe that may be the best information available that you can apply. And the reason systems are crafted that way is that they're meant to enhance and assist the person versus replace the person. I've seen articles written, will cognitive systems replace people? Not in my foreseeable future, at least. It's meant to say that if you're a clinician, can a cognitive system give you information more rapidly that you could then use to make a decision? Yes. Or the experiment, not even an experiment, the capability that was developed in the University of Texas by some students who took one of our Watson solutions and said, 211 services are complicated. If someone's a homeless person, they want to find out where can I get these benefits, they've got to navigate a lot. Why can't they just say, I live here, I need these benefits, where do I go? And they built a Watson-based solution that takes all that information and answers that kind of question in a simplistic way that accelerates their ability to use information. So it's complementary versus replacement. I think one of the things that can be useful sometimes is to say, when you talk about cognitive, and we keep throwing out big words, what do we consider cognitive? What is cognition in a person? So this little model that you see describes how Watson evaluates something, and we think it parallels how people look at things. You observe information, you observe what's going on around you, and you're trying to understand and make sense of it. And when you do that, you interpret and evaluate it. You create a hypothesis, if you would. What's occurring around me? How should I interpret it? What are the choices that I can make sense of? And then I decide. Based on that decision, I've drawn some cognition. What we approach with cognitive systems like Watson is the ability to say, gather the evidence, the information, which can come from many sources, which is important. It can be from information around someone's health history, obvious case. It can be information from their social media experience. It can be information from journals, a variety of sources that can be relevant. Interpret which ones are most applicable and form a hypothesis to the answer to the question. Claude's going to try to find the car. Well, if the car is on the campus at Hopkins, we have some evidence about what the choices are and where he might have parked the car because he doesn't work here, so that kind of limits choices too. And then say, I think you're more likely to find it here. That's what you ought to be looking for. That's cognition. That's the aid that we're looking for. So that's what Watson attempts to do with people to help them make sense of information. This would be kind of an interesting thought experiment if we said, we do that, so why do we care? Why is this important? Why is this changing things in a significant way? And what I'd suggest to you, it's this number. It's 2 numbers. First, it's the number of gigabytes of data that get created constantly that influence the decisions we need to make. And it's an enormous number, and it continues to grow. I heard a stat recently, and I can't recall the exact statistic, but essentially said within the last few years, we've created more information than we had created for decades in the past, just because of the volume and how quickly it's advancing. But the other interesting aspect is 4/5 of that information is what we call unstructured, which is text. It's not something that's in a database. It's not something you can pull out that's already structured and analyzed for you. It's information you need to make sense of. And that is what Watson aims at, the unstructured information, which current IT systems, for the most part, tend not to do very well with. And the question is, what's in there that's interesting? So let me offer you some suggestions. We did a project with an organization in Texas on healthcare, and it was the prediction of the development of congestive heart failure. And they built models, and we looked at the clinical information we could gather internally to determine what would be the most likely predictive factors. But what really came out of it was there were factors that we couldn't get data for that actually had more influence than some of the ones people cared about. Do you really smoke? And people didn't tell the truth. How much did you smoke? And people didn't tell the truth. So looking at your EMR is not going to tell you what's really going on. When you go home, are you alone? Are you 70 and you're alone and that's it? You're going to take care of yourself? And have you had substance abuse issues? And is that going to continue? Because just because you have congestive heart failure doesn't mean you change your life. All of these factors had as much in influencing readmissions and the future development of that person's health and their wellness as anything else. But that data was stuck, in some cases, in notes and other sources that were not available immediately unless you extracted them, and then you needed to know where to find them. So that kind of determinate information is what can make a difference in the approach that you take with analyzing information. So let me give you a few more examples that I think can be relevant to some of these questions. So this categorizes 3 types of things that we think cognitive is relevant for: helping with decisions, assisting with discovery, or with engagement. The idea of engagement is a bit of what I mentioned before with the service that the students at the University of Texas developed, which was, how do I simplify an interaction and make it feel like I'm dealing with a human on the other end who can summarize for me what I'm looking for? So in their case, it was, where do I get aid? Where can I help my family? Where is the assistance that's necessary? Where are the clinics that are available? You can also parse it to another level, which is interesting, get outside of healthcare. We're working with a large city on building codes. Because what they discovered was they make a little bit of money, actually make a fair amount of money, charging people fines for violating building codes. But their building codes have been developed over years and years, and they're very complicated. And if you want to go do something, it actually takes a fair amount of studying to figure out what codes you have to meet. They were looking for a system, which we're working with them on, to analyze the building codes and say, if I'm going to open up a store in this address, is it zoned? What are the restrictions? What are the prior violations? Pull it up and help me understand what I should do. Because what they want is economic development. They don't want to collect money from just working with building codes. So again, it's the focus of what you want to accomplish. With discovery, we've built systems that look at different aspects of discovery. Clinical trials matching to bring people into programs, both from the perspective of a life sciences company trying to figure out how to get the right programs available, as well as someone who's providing care to say, what can I enroll them in? As also, the other work we've done is around genomic analysis. How can you pull genomic data to help you find possible interactions for a medical condition or other areas that are worth exploring for a drug that's under research, for example? On the clinical side, you may be familiar that we've built systems around oncology to help clinicians up at Memorial Sloan Kettering, we also did it at MD Anderson, understand what the possible pathways are, what's developed in the field, how might they best provide care. So all of these, if you think about them, can be solved different ways, but we think that what makes the difference with the cognition is the ability that we'll go to before. Can you make it so that a person views that the system's an extension of their own faculties? You have an expert sitting next to you, a friend of yours who's quite versed in a particular topic. You can turn to them and ask a question, and you get an answer back that says, your most likely options are these. And here's the reason why you ought to consider it. Here's the evidence that supports it. And we think increasingly that cognition about these 2.5 terabytes and what have you of data that are constantly evolving and growing into the system is what's going to make a difference in the way that care is provided, as well as other services are provided, and frankly, across the whole spectrum of different industries. So I want to spend a minute about something, more than a minute, about something that we've announced recently and talk to you about the theme behind it. and that is what we call our Watson Health Initiative. I want to emphasize the word health here. You didn't see Watson Healthcare because we believe this is broadly applicable. It can be applicable to health of a community, health of a family. It is not just to provide improved healthcare services. The point is we think that there are some key aspects of information sharing and information collaboration that can make a substantial difference moving forward. And the emphasis is really around three things. The first is data, and that is bringing together an open pool of data in the cloud that allows you to share information and aggregate it with others. Because a lot of times what we've discovered is you may have a set of the information that's relevant to you, but if you're doing population health analytics or other things, you don't have the broader view. But if you can put your data in the context of a larger set of data, you can discover opportunities you wouldn't see otherwise. So it's the ability to share data and to aggregate it and combine it with others and make that data broadly available. And that also raises the question of how you start thinking about standards in that data. We're dealing in a different domain with all the unstructured data than we have with the more structured aspects of transaction handling in the past. The second is insights as a service. One of the discussions we're having is with one of the academic medical centers that's done a lot of genomic research. An area of interest is personalized care, but more importantly, they believe from their experience treating that they've been able to extract information through the genomic analysis that's highly predictive of interaction with certain medications. And they think they've actually prevented some serious counter reactions to certain medications. And that is a capability that if you applied it to a broad set of people as an ongoing service would be important. Another kind of service is the ability to do population health management, or to apply it in the social services aspect that we described before. But essentially, it's in the cloud services that allow you to understand that broad base of information more effectively. I got a question earlier that I thought was interesting, which is how do you prevent obsolescence? And I think obsolescence is one of those challenges. You start building something, and by the time you've built it, there's a better something. And now you're wondering where you go with what you've built. The intent of building services as a SaaS or software as a service capability that is deployed with your colleagues and your partners and then is maintained by them on an ongoing basis is avoiding you building the one-off and being able to leverage what others have built and build on top of it. Our ambition would be someone may have a great analytic who can make it better, and who can add to that analytic, and who can add to that analytic. And some of our partners that are involved in this include Apple and Johnson & Johnson, Medtronic, and others that have been focused on this. And the solutions with those partners are how do you take it back to the consumers of this information and make it useful for them so that they can make better decisions and apply it to the choices that they face. To kind of put a wrapper or a bow on this, going back to the beginning of our little discussion here, what we were looking for was to say there's an explosion of this new type of information. We haven't got a particularly good handle on it, frankly. I don't think anybody does, of all of the unstructured data that's out there, that has data that affects how we can make decisions. But by using a service like this that allows us to enhance collaboration and encourage information sharing and influence standards development across it, we have the ability to advance a cause, and we think that this can have a substantial impact towards social services, healthcare services, and other opportunities. The reason it's a moonshot is it's large, but the other reason it's a moonshot is it has a big payoff. It can have a very substantial influence on where you go from here. My colleagues, Joseph Fiorentino, Martin Duggan, sitting over there at the table, I think would be glad to talk to you more about what we think in terms of its possible application. But they asked me to ask you this question. What I tried to represent to you here is a work in progress. I'd be the first to tell you cognitive systems in Watson are early. There's a lot that's out there that you can apply, but they're evolving. It's kind of like I joined IBM Corporation just after we made our first PC, I think it was. I remember being in Boca Raton and they were showing it off. Since that time, That has advanced quite a bit. In fact, all of those PCs long ago, and PCs in general, are kind of obsolescent in a lot of ways these days. We are at that kind of stage with cognitive, very, very early. And there's a lot of opportunity for advancement. And you have the opportunity to really influence us in our thinking. Where do we go, and how do the standards develop in these kinds of solutions? How do we shape them to be most applicable to the kinds of problems that you're facing? I hope this gave you a sense for where we see the opportunity with cognitive systems, where they may develop and where they could be applicable to you. And we have, I think, about 5 minutes from the session left, so if you wanted to entertain any questions or however you'd like to proceed.
No? Yes, okay. If we only have a few minutes, I think I have a couple questions, but I'd much rather they come from you all. Anybody want to give a start? Anything? Okay, so I'll start. First, at the very beginning, I thought it was interesting. I thought I was going to hear about Siri. You know, ask her anything and she'll give you the answer. Just one question that I had, what does it mean for Health and Human Services? And I don't know how far along you are, checked out the website, but I don't know how far along you are using Watson in this realm. But are there any concrete examples you can give us just to sort of stimulate how it can be used for any purpose for which it is currently either planned or being used in this realm?
Sure. I'd offer maybe my colleagues want to also
Sure.
comment as well.
Is there
Thank you. But I think the first one, with the social services, we have been looking at a couple of different opportunities. One is the aggregation of information into a single setting to assist you with making a decision. So the point is, can we take multiple sources of data that are in disparate data sets today, incorporate them into one location, and apply the natural language capabilities to make sense and find facts in there that influence decisions. And we've been doing that with primarily healthcare organizations who are looking to enhance their EHR, EMR implementation so they can have a more complete view of their patients and treat them more effectively, something like that. I think they're applicable at the community level for community health. The Texas Initiative is a great one for navigation and the applicability of being able to help people find the right sources of information.
Great. Is there a mic?
So I'm sorry, this is going to be a little technical, but something I'm very concerned about, and I'm wondering if Watson is a potential solution. Unstructured data, beside the fact that it's difficult and you might need natural language processing to handle it, has another hidden danger that I think we're not talking about enough, and that is Trojan horses. For example, in the continuity of care documents, the C32 to CCDA, you can have elements which are HTML. You could stick all kinds of code in there to do all kinds of things and end up in another arms race. I'm wondering, but a code, and some of this stuff could be clever, is something that in theory, a computer program as they exist now can't really recognize these things unless you program every single possibility like the antivirus software does. Does Watson have the ability, or could Watson have the ability to start discovering these kinds of Trojans? Because we're going to have more and more of this going on, and as people start realizing the value of personal data, I think if it's not happening right now, and I'm hoping I'm not giving anyone any ideas, this could be a real problem. But since 80% of the data that we're getting every day is unstructured, it seems that this is an important concern. And I'm just wondering if IBM has thought about this, if Watson isn't potentially a potential solution for this kind of problem.
It's a great question. I think there are a couple aspects we're looking at. One is we are doing some work in the government sector, looking at how Watson can help identify sources of intrusion. Because what ends up happening is the most important thing you want to find out is where it came from, so you can localize it and identify it before it affects you again. So there's work occurring in that realm of investigation, to your point. How do you prevent the event? The second aspect, like you were saying, is let's suppose that there was a 1 megabyte text blob, and inside of it you embed 3 viruses. And you choose to process, and somehow those viruses are clever enough that they attack your system. I think the reality of the situation, we pre-process data, right? We don't just accept it clean and load it into a system. I think that there will be, kind of like with antivirus systems today, constant evolution because people come up with new techniques to try to attack a system. It'll be an evolving target. I think the primary emphasis today is we don't just take a piece of data sight unseen, process it, accept it, and then make it available. The second is there's a little bit, and you know, this is an area I'd be glad to discuss further if you're curious. In the architectural approach of Watson, the text data is not treated as executable data. The text data is a reference that the executable data looks at to pull back, I found a fact. I can now use that fact, but I don't try to execute that content per se. It's a reference base. That doesn't mean I don't put it past a very clever person, someone who has a lot of time on their hands that says, but what about? So I think it's an area of focus. There are areas where we're looking at it as a cybersecurity kind of capability, you know, to assist with management of those kinds of events. Did I help you with your question?
Yes,
We can take one more, please.
Watson is designed for facts, but not for the.
Let's do it over.
Sure. Watson is designed for, or tries to be designed for facts, but not necessarily for the data that you're talking about for the use case you presented. There's a small startup company, Healthify, that does what you're describing. They go to a community, they aggregate all the resources, but then they call all the resources to double check on all the data to make sure that it's actually correct. Mm-hmm. So assuming that you can just go to the web and suck in the data may be too simple-minded for the frontline CHW who, you know, doesn't want to waste time on wrong information. If there's a warrant or if there's a statement that
Sure.
the data is accurate.
No, good point. Good point. I think, and this is to the heart of what you do by bringing yourselves together. All of this, I would strongly emphasize, is an evolving field. You're not looking at finished, accomplished, done. It's a starting point. And the request is, where can you help define where it goes and how it develops? And I think that's the opportunity, working with organizations like yourselves, to help set the standards and understand the applicability. It is growing in different rates in different industries, and we'll see how it evolves over the next 5 years. So perhaps, I think you saw a Watson presentation when we first won Jeopardy. 5 years later, I'm here. So maybe we'll make a date that 5 years from now, someone will come in, and I'm expecting they'll have a lot more details to share with you at that point, if that works for you.
Thank
All
you
right.
so much.
Thank you.
Thank you all.
Appreciate your time.